You've gotten the flyers in the mail and seen the commercials. Medicare Advantage plans offer all these additional benefits for $0 per month. Seems too good to be true, so is it a scam? The answer may surprise you. So first, what are Medicare Advantage plans? Well, Medicare Advantage plans are an alternative to Original Medicare. So they replace Original Medicare entirely. Now, these are not to be confused with Medicare Supplement Plans, also known as Medigap Plans. These types of plans work with Original Medicare.
So as I said, Medigap plans work with Original Medicare, and there is sometimes an out-of-pocket maximum. For plans like G, F, and N, most of your medical expenses are going to be covered, so there isn't really a need for an out-of-pocket maximum. And then for plans K and L, those are the cost-sharing plans, so there is an out-of-pocket maximum. And of course, Medicare Advantage plans will always impose some type of out-of-pocket maximum. For Medigap plans, there may be medical underwriting. If you don't enroll in that initial 6-month window when you are first eligible for Medicare after you turn 65 and enroll in Part B, then you may be subject to medical underwriting, which means you could be charged more or denied. That's not the case with Medicare Advantage. With Medigap, those benefits and plans are standardized. So regardless of who your carrier is, because they are offered by private carriers, the benefits offered by Plan G will remain the same across the board. The benefits offered by Plan F will remain the same across the board, and so on and so forth. That's not the case with Medicare Advantage. Those benefits can vary widely, but generally speaking, you will notice that they'll have lower deductibles, copays, and coinsurance when compared to Original Medicare alone. Now, Medigap plans do not offer additional benefits that aren't already offered by Original Medicare because they're really just a financial solution, meaning they're going to fill in those financial gaps of the copays, deductibles, and coinsurance, whereas Medicare Advantage plans may offer benefits like dental, vision, hearing, prescription drugs, and more. Now, Medigap plans do not require referrals or pre-authorization, and that is a great thing. Unfortunately, Medicare Advantage plans may require referrals, and they certainly have pre-authorization. And then also it's important to note that regardless of the carrier that you choose with a Medigap plan, if your doctor or hospital accepts Original Medicare, and almost all do, then they will accept your Medigap plan. And with a Medicare Advantage plan, you will have to operate within a network, and those networks can be extremely restrictive.
Remember, if you still have questions, you can reach us in the comments below or at the number on the screen. There is, of course, no charge for our services, and we are licensed nationwide. And please make sure to like this video and subscribe as well to stay up to date. Now, Medicare Advantage plans are offered by private carriers, and they're not standardized, so benefits can vary widely. They may be similar to the type of insurance that you've had in the past. Now, although, as I said, they are not standardized, they must offer at least the same benefits as Original Medicare. But very often, these types of plans do offer additional benefits, such as those benefits that they advertise. Things like dental, vision, hearing, prescription drug, and more. So they do claim to offer all of these benefits, but is it really true? Well, let's take a look at the plans. Now, I know we're talking about some of the upsides of Medicare Advantage right now, but don't worry, we will get to why some people consider Medicare Advantage to be a scam in just a minute.
So on Medicare.gov, if you scroll down to where it says Find Health and Drug Plans, then you will put in your zip code. I'm putting in a New York zip code today. We're just going to look at Medicare Advantage plans. It'll ask you if you get help with your costs from any of these programs. I'm going to put that we don't get help from any of these programs. Do you want to see your drug costs when you compare plans? That's a great idea if you do have prescription drugs. But for today's video, we're just looking at the benefits, so I'm going to say no. And here are the 44 Medicare Advantage plans available in the zip code that I entered. So let's take a look at some of those benefits offered. So for our first Medicare Advantage plan that it's showing us, which is an Aetna Medicare Eagle plan, a PPO, it offers vision, dental, hearing, not transportation, fitness, worldwide emergency, and telehealth, and it does not include prescription drug coverage. That's listed separately. Now, if you do want to filter by drug coverage, then you would just go over here and click Includes Drug Coverage. And now we're down to 38 as opposed to 44 plans. So as you can see, the first plan that it's showing over here does offer prescription drugs, because if you were to add your prescription drugs, it would give you an approximate cost. If you want to see more benefits, click over here where it says More Benefits, and it'll show you some more of the common benefits. These are the most common benefits that are offered by Medicare Advantage plans, so this gives you a pretty good snapshot. However, if you wanted to dive further into it, you would just click on the plan details. If you want, you can scroll back up and add some plan benefits so that you can filter by that as well. So let's say we want all of them. Then there are 11 plans available that offer all of the benefits that we put in: vision, dental, hearing, transportation, fitness, and drug coverage. That being said, of course, these fringe benefits are excellent, but you should really make sure that your Medicare Advantage plan, if that's the route that you're going to go, that your Medicare Advantage plan really covers your basic medical needs in a fashion that is best suited to your specific needs before taking into consideration these fringe benefits. Because these are great to have, but you can certainly purchase vision or dental coverage at an inexpensive rate separately, but you want to make sure that your medical needs are taken care of. Usually it is in your best interest to enroll in a plan that offers some type of drug coverage. That way you don't have to enroll in Part D as well. So this plan offers all of these types of benefits. This is a breakdown of the costs. More on that in just a little bit. And as I said, if you wanted to look further into the benefits, you could click there. Let's go to Extra Benefits, and you will see exactly what benefits are offered and what costs. So here's the hearing benefits, the preventative dental, comprehensive dental, as well as these copays. You're always going to see that limits apply, especially with dental. Vision. Let's look at some more benefits. No chiropractic services, but some acupuncture is covered. No massage therapy. What a bummer. No alternative therapies. Scrolling down, we already knew that fitness benefits were covered. There is some coverage for transportation services, some coverage for over-the-counter drug benefits. So some Medicare Advantage plans will offer you some type of discounts or up to a certain amount of money that you can spend in a given amount of time. Basically, they'll give you that money to use at certain pharmacies and drugstores. Coverage for meals for a short duration, telehealth, worldwide emergency, etc. So that does give you an idea of the availability of some of these benefits. Now, I picked New York today as opposed to some place like Florida because in Florida, the Medicare Advantage plans are definitely a step above the rest of the country. So I wanted to give you a better idea of what some of the Medicare Advantage plans look like in general so that you can see that these benefits that they talk about are not that hard to come by. So you can definitely see why Medicare Advantage plans are so appealing to so many people, but we are going to talk about why so many people still consider Medicare Advantage plans to be a quote-unquote scam.
So are these plans really free? Well, although these plans may claim to be free, that's not exactly true. At the very least, you still need to continue to pay for your Part B. That being said, for many plans, there is no additional cost. Now, if it sounds too good to be true, it may be. So how do they offer these additional benefits at no cost? Well, to Original Medicare, you are considered a risk. So Original Medicare is willing to pay a set amount to a Medicare Advantage plan when they take you on as a beneficiary and therefore take you on as a risk. So basically, Original Medicare is just looking to pawn you off on somebody else. But Medicare Advantage plans aren't exactly doing this out of the kindness of their hearts. They are still out to make money. So let's talk about some of those parts that you don't see in the brochures and the commercials. Yes, there are some major downsides. When things sound too good to be true, very often alarm bells start going off, and with good reason. There are two major reasons that many people consider Medicare Advantage plans to be a scam. Or at the very least, they feel like they were misled by their Medicare Advantage plan, and it's not something that they wish to continue in the future. The first problem with Medicare Advantage plans are the networks. Medicare Advantage plans operate within networks, and very often these networks can be very restrictive, and doctors and hospitals won't contract with them. And there is a very good reason that they won't contract with them, which we'll talk about in just a minute. Medicare Advantage plans do offer HMOs and PPOs. A PPO will of course give you more flexibility. You don't have to have a PCP, which is a primary care physician, and you don't need a referral to see a specialist, and of course you can go in and out of network. That being said, the Medicare Advantage networks, as I said earlier, are usually very restrictive, and people have often reported difficulty finding a doctor, especially specialists, who accept their plan. Sometimes they have to travel hours to find a doctor within network. So why don't doctors and hospitals want to work with Medicare Advantage plans? Now, yes, they may pay less than other health insurances, but so does Original Medicare, and almost all doctors and hospitals accept Original Medicare. And that's just not the case with Medicare Advantage. So what is the issue? Well, Medicare Advantage plans are considered managed care plans. Therefore, you have the issue of pre-authorization. That means that even if your doctor has referred you to a specialist or some type of treatment, Your health insurance plan first needs to pre-authorize that service or treatment before you can go and have it covered. Some carriers are definitely better than others and more willing to work with their beneficiaries, which is a reason that you definitely want to work with a broker who can give you some background information on the reputation and flexibility of that carrier. So certainly some carriers are better than others, but you may find that you are denied for a certain treatment or service, even if your doctor has recommended it. At the very least, there's certainly some hoops to jump through in the form of paperwork. So doctors and patients don't like this. So knowing what you know, would you sign up for a Medicare Advantage plan? Have you signed up for a Medicare Advantage plan and now you want to make the switch back to original Medicare? Well, remember that if you're in your first year of signing up for a Medicare Advantage plan, you're still in that trial right period, so you can switch back to original Medicare very easily during that time. If you have any questions, give us a call at the number on the screen or in the comments below. We'll see you next time.
If you want to learn more about Medicare Advantage versus Medigap, check out this video. And please don't forget to like and subscribe to stay up to date. We'll see you next time.